My name is Timur Abdullaev. I am from Uzbekistan. I am a public health and human rights consultant and a TB survivor. The first time I found out that I have TB was because I was coughing. I was a heavy smoker at that time. I smoked like a packet of cigarettes a day. Eventually I quit smoking, and still it didn't help to stop the cough. And besides, I was living with HIV at that time. So I went to the clinic and it turned out that I have TB. TB is not just the #1 infectious killer in the world, it's also the #1 killer of people living with HIV. It's the leading cause of death for people living with HIV. Chances for a person living with HIV to have tuberculosis are higher, much higher than in average population, in common population. The only way we can end the epidemic is if we work together in partnership. It should be a collective action. It should be policymakers, decision makers, researchers, of course medical professionals and doctors and nurses, but also civil society, people who had TB in the past, private sector. It should be really like genuine collective effort of everyone. Because it's not just, the patients who are affected, it's the society which is affected. And if we don't respond as a society, if we don't respond as humanity, we will never beat TB. And we will lose the war to some brainless bacteria with all our brains and technology. I think that the only way to work together is to be open, is to recognize that tuberculosis is a very serious problem for people living with HIV. So we have to tackle it as such.